Comparison of renal pelvis drainage pattern on sonography with renogram drainage pattern in suspected pelviureteric junction obstruction. The biggest dilemma that a radiologist and a clinician faces when we come across cases of prenatally detected PUJ-like obstructions is how do we differentiate an obstructed system from a dilated but non-obstructed system? An obstructed system will always have a poor drainage, whereas a non-obstructed system will have a good drainage. So the question is, how do we assess the drainage across the PUJ? The gold standard for this is doing a renogram. On renogram, there are different parameters which are used to, like the drainage curves, the T-half values, or NORA. T-half is the time taken for the radionucleotide activity in the kidney to decrease to 50% of its maximum value. If it is less than 10 minutes, we say it is non-obstructed or good drainage. More than 20 minutes is obstructed or poor drainage, and anything in between is equivocal or partial drainage. The second parameter, which is gaining lot of prominence nowadays, is NORA, that is normalized residual activity. It is calculated by dividing the uptake values at 60 minutes by the uptake value at 2 minutes. Anything less than 0.5 is good drainage. More than 1.8 is poor drainage, and anything in between is partial drainage. NORA is far better than T-half values and as well as drainage curves because it takes into consideration the reservoir effect. That is, unless the renal pelvis is completely full, it will not empty. And this is important because renal pelvis in children is elastic and compliant. Secondly, it also takes into consideration the effect of gravity because it is calculated at 1 hour, and the effect of full bladder which can interfere with the bladder emptying is also negated. But the commonest investigation which is done immediately within a week after birth and for subsequent follow-ups is sonography. And thus, the question that we need to ask ourselves is, can we identify poor drainage of pelvic-calyceal system on ultrasonography? Well, way back in 1968, then in 1996, and again in 2000, it was found that the kidneys, or rather the pelvic-calyceal system, drains better in prone position. And we also published 2 articles based on this in 2012 in Journal of Urology and the other in 2017 in Gold Journal of Urology, where we found that if we measure the AP diameter in supine position, which is done by measuring the diameter of renal pelvis within the confines of the renal parenchyma at the level of the renal hilum in an axial plane, just as shown here, and then compare it with the same parameter in prone position and measure it same way in the prone position, just as shown here, then we can come across 3 different scenarios. If done on an empty bladder and if the AP diameter decreases by more than 10% in prone position with no calyceal dilatation, it is good drainage. If the AP diameter increases by 10% in prone position and if there is increase in calyceal dilatation in prone position, then this is poor drainage. And anything which falls in between these two is partial drainage. The aim of the study has been to compare the drainage pattern predicted by ultrasonography with those predicted by T-half and NORA. We started doing this study from 2014. It is still continuing. All patients with suspected PUJ-like obstructions were included in the study, provided they had undertaken a sonography and a renogram based on F0 protocol. Those patients who had associated reflux, stones, or ectopic kidneys were not included in this study. The statistical analysis was done using the Spearman's Rho correlation and the Kendall-Taube correlation. We so far have had a total of 268 patients, where right-sided hydronephrosis has been seen in 98, 200 males and 68 females were part of the study, and the age group has ranged from 1 month to 70 years. When we do a comparison of these drainage parameters, we find that there are 79 patients who show good drainage on ultrasonography as compared to only 20 with T-half and about 109 with Nora. Likewise, the numbers are different when we take into consideration what is determined as poor drainage by sonography, T-half and Nora. When we apply the Spearman's Rho correlation, it's seen that sonography and Nora are having a strong positive monotonic correlation, which is not present when we compare it with the ultrasonography results with T-half or Nora. Likewise, the Kendall-Taube correlation also finds sonography and Nora to have a strong positive correlation, which is not found in the other two parameters. So, in conclusion, all three correlations are positive and statistically significant. But the strongest association is between ultrasonography and Nora, suggesting that these two measures are closely linked. Correlations with T-half are weaker. Sonography can thus be used to monitor patients with suspected PUJ obstruction. If we can determine the drainage pattern of pelvic calyceal system based on sonography, the number of renograms that we need to do can come down drastically. Also, many of these patients who show good drainage on initial and subsequent ultrasounds can be monitored only by sonography, and importantly, sonography and Nora can be combined along with other parameters on renogram like the CTT, that is the cortical transit time, to determine the need for surgery before any irreversible damage to the kidneys set in. Thank you.